D-E-F-P-O-T-E-C.
Excellent, and that's 20/20 vision for the right eye. If you want to just take a second, and then what I want you to do is cover your left eye and read with your right eye.
D-E-F-P-O-T-E-C.
And again, 20/20 with the right eye. And if you can, take a second, and when you're ready, go ahead and read the lowest line.
D-E-F-P-O-T-E-C.
Excellent, and so Christy's vision is 20/20 from a distance. And Christy, if you can, go ahead and have a seat for me. And Christy, this is the Rosenbaum chart. And so for the Rosenbaum chart, what I want you to do is I want you to hold it about 14 inches from your face. I can hold it if you need to. And again, starting with your right eye, I want you to cover that with your right eye and read the lowest line that you can.
428-739.
Okay. And if you can, go ahead and cover your other eye.
428-739.
Excellent. And with both eyes, please.
428-739.
And I'm going to go ahead and take the chart and just confirm. And on reading the chart itself, Christy is 20/20 vision on the Rosenbaum chart. So the next thing we're going to go ahead and do, Christy, is if you can, is we're going to do a peripheral eye check. And if you want to go ahead and sit with your legs over the side, please. I appreciate it. And so Christy, what we're going to do is we're going to go ahead and face each other. And when I face each other, what I want you to do is take this index card and cover it over one eye. I'm going to be coming in with different angles, and what I want you to do is let me know when you peripherally see them, okay? So if you can cover the right eye, just like I am. And so let me know when you can see it.
I can see it.
Okay. And let me know when you can see it.
I can see it. I can see it. I can see it.
No, just let me know when you can see it. Coming in.
I can see it.
Excellent. Good. And now, do me a favor. Go ahead and switch to the other side. And let me know when you can see it.
I can see it.
Okay. Okay.
Yeah, I can see it.
Excellent. Good. So in this case, she has all fields of vision. And then what we're going to do now is we're going to go ahead and go to the check of the 6 cardinal phases. And so looking at that, what I want you to do is this. We're going to do a accommodation of your eye, okay? So what I'm going to do is I'm going to put my finger up, and what I want you to do is follow it as you can see. Nope, just your eyes. Okay? And as you can notice with Christy, there is a slight, she is positive on the 6 cardinal fields with no gaze noted and no nystagmus noted. So the next thing that we're going to do is we're going to do an accommodation. So what I want you to do, again, is I'm going to have you look left, and just follow my finger only, okay, and look right. And then when I come in with my finger, what I'm seeing is that the eyes come in equally and that they're equal and reactive. So at this point, what I'm going to do is I'm going to go ahead and do a assessment of her eyes themselves. I'm going to use my ophthalmoscope. And with my ophthalmoscope, what I'm first going to do is inspect the eyes. And when I inspect the eyes for Christy, that we can see that they're equally distant, that on the inner cannon and the medial cannon on both sides is equal. We also look at the lateral cannon, and that's also equal. So as we do our assessment, we also want to look at the sclera itself, and Christy, if you can look over to the left here. So when we look at the sclera, we can see that the sclera is white on both eyes, and it's equal with a slight pink. And what we'll do is we'll have her also follow to the other side, and we'll look at the other part. And as you can see, she has a slight nystagmus noted, along with the sclera being pink. Now, Christy, if you could look forward right at the camera for me. What we're looking at is the iris itself, and we can see that the iris is brown. And we look at the pupils, and the pupils are about 3 millimeters. When I go ahead and bring in light accommodation, what I want to do is bring it in slowly. And as we can see, Christy's eyes both react to light. So in this case, her eyes are perla. They're equal and reactive to light. There's no pigmentation. Now, if we look at the back of the eye, what we're going to do is we're going to see that we're going to look in the very back of the corneas. And when we look at the optic disc, what we want to look for is we want to look for any kind of bulging of the disc itself, any kind of redness in the back of the eye, or any kind of discoloration. And so in this case, this was normal for her. So for the eye exam itself, it looks like the pupils are equal and reactive. Now again, we're also going to look at the eye muscles and the eyebrows. And if we look at her eyebrows, from the inner canthus to the outer canthus, bilaterally, she has equal distribution of hair, and she has equal eye movement. There's no delay in the eyes itself. And the cornea itself, when we looked at it, was transparent and negative for any kind of scarring or cloudiness. As we look at the eye shape, it's brown, it's symmetrical, and it's round. And the pupils are about 3 millimeters with a brisk transition to light. So the next part we're going to do is we're going to go ahead and move on to the ears. And I'm just going to grab the otoscope. So for the inspection of Christy's ears, what we first see is that, Christy, if you could look straight ahead, what we're seeing is that the ears themselves are equal at the auricle. We're also seeing that the ears themselves are symmetrical bilaterally. If we look at Christy's earlobes, if you could turn your head to the left, please, we can see that the earlobe is normal. Again, she does have some piercings. We look at the tragus, and the tragus is normal, and then we look at the pinna of the ear itself. And so this is a normal earlobe, and if we look, Christy, if you could look to the left, we're also going to do the same thing on the left side. And again, the tragus is midline, the pinna is okay, and the earlobes are appropriate. So that would be appropriate outer ear canal. So at this point, what we're going to do is we're going to look at her inner ear. And when we look at her inner ear, what we want to do is we're first going to go ahead and put a scope cover in, and we will slowly pull up and back in order to expose the ear canal. And when we look in the ear canal for Christy, there's negative for serum. We also look at the back of the ear when we're looking in there, and what we will see, if it's a normal ear, and in her case it is that we'll see that the eardrum itself is transparent. We also can see the bone structure. Now, what would be abnormal would be if it was redness, if there was any white or bulging of the disc, or excessive serum in the ear. And in that case, we would need to go for a further assessment. I'm going to also check her left ear for the same. And again, you're going to pull the ear up and back. And I'm going to, again, assess the ear itself. And this ear is also normal. So that would complete our ear sound, inner inspection of the inner ear and outer ear. Now the next thing that we need to check for is we need to check for her hearing. And so in order to do that, what we're going to do is we're going to go ahead and do the whisper test. And so Christy, I'm going to just step away a couple feet away from you here, and let me know if you can hear this. Ball, cat, dog.
Yes.
Okay, and what did you hear?
Ball, cat, dog.
Okay, good. And so we're going to do the same on this side. Cat, dog, car.
Cat, dog, car.
Excellent. And so Christy's able to hear both sounds equally, laterally, and about 2 feet apart. So she would pass the whisper test at that point. The next test that we would be doing is we would be doing the Weber test. And we need a tuning fork in order to do the Weber test. And so for the Weber test itself, what we're looking is for lateralization of both hearing. So once I hit the tune fork, what I want to do is I want to bring it right over the center of the head. And Christy, can you hear the noises equally? Okay, so let's try that again maybe. Okay, let me know if you can hear that equally on both sides.
A little bit, yeah.
Okay, so if it wasn't equal for both sides, then we'd be concerned that there's some sort of neurological defect of the ear itself, or if there was a hearing deficit. And so we would make note to what side she cannot hear from. The next is we're going to do the Rhines test. And when we do the Rhines test, is this loud?
Yep.
And you're able to hear that.
Mhm.
Now when I put this on the back of your mastoid bone, are you still able to hear it? Is the sound as loud or is it minimal?
It's minimal.
Okay. And so that would talk about ear conduction versus wave conduction through the mastoid. And so that's a normal finding for Orion's test. And again, we'll do the same thing on the right side. And can you hear that? Okay, let me do that again. Can you
Yep.
hear that now? Okay.
Mhm.
And then when I put this to the back here, can you hear it now?
Yep.
Excellent, good. And is it as loud or is it
No,
lower?
it's lower.
Okay, excellent, thank you. So in that case, we've completed our ear test. And so for the Rhine test itself was appropriate. Again, you always have to make sure that you knock the tuning fork loud enough for it to vibrate and so that the patient can hear it. So next, what we're going to do is we're going to move on to the nose. And so if we look at the nose itself, what we're first looking for is the nose symmetrical to the face itself, and the nose is midline. As we go ahead and assess the patient, we can notice that there's no drainage or epistaxis noted, and so the nasal cavities are clear and equal. If you can turn just slightly. And as we can see, if we look up, there's no drainage, and the septum appears to be midline. So the next part we're going to do is go ahead and inspect the inner part of the nose. And so when we inspect the inner part of the nose, what we want to do is we're going to go ahead and use our otoscope again, and again change the covers. And what you're going to do is you're going to look up into the ear, and into the nose. And when you look into the nostril, what you're looking for is the midline, the nostril, the septum to be midline and pink, and it is. And we're also going to look for the turbinates of the nose to be symmetrical and equal. We're going to look for any kind of nasal drainage or epistaxis, and the right nostril is negative. At this point, we're going to go ahead and move to the left nostril and do the same thing. And so, Christy, if you can just keep your head right there. And again, the septum is pink. There's no nasal drainage or any kind of changes with the turbinates themselves. And Christy, do you have any sinus problems or any kind of sinus pressure?
No.
Okay, so at this part, what I want to do is I'm going to check to do with the eyes and also with your sinuses. So
Okay.
one part that I didn't check initially, but I'm going to be checking now, is the lacrimal ducts. And so the lacrimal ducts are a set of ducts in the upper part of the eye for tear production. So I'm looking at the actual lateral ducts themselves, and they're not warm, swollen, or protruding. And then what I'll do is I'll check for the lacrimal sacs, and the lacrimal sacs are flat and appropriate. And so therefore, we're looking in the tear ducts and the lacrimal sac is normal. So at this point, what I'm going to do is I'm also going to check you for any kind of sinus pressure or pain. And I'm feeling throughout the sinuses for bulging, pressure, or pain, and I don't notice any of that through Christy. So that's a normal exam. So what I'm going to do now is just change my gloves. And Christy, the last part of the nose would be how is your smelling? Do you have any decreased smelling?
No.
So in this case, the olfactory nerve is intact. So the last part is going to be the mouth and the oropharynx. And when you check the mouth and the oropharynx, the very first part we're going to look at, as Christy's licking her lips here, is that we're going to look for them to be pink. And in her case, the lips are pink. They're free of lesions or any kind of cracking. And we're also going to look for the fact that they're symmetrical. And so there's no oral lesions noted, and the mouth itself is symmetrical. Can you smile for me? Okay. And as we look, we're going to look at the facial labial smile, and you can see that it is symmetrical bilateral. As we go ahead and look into the mouth itself, we're going to have Christy open up, and we're going to look at the teeth itself. And so if we look at the teeth are uniform throughout, and she does have one discoloration.